What specific thyroid tests do I need? If you're wondering whether your thyroid is working properly, knowing which tests are necessary can help you and your doctor get to the root of any issues. Thyroid problems are common and can affect your energy, mood, weight, and overall health. The right tests can tell if your thyroid is overactive, underactive, or functioning normally. Let's explore the main thyroid tests, when they're used, and what they reveal about your thyroid health. The most important test is the thyroid stimulating hormone test, or TSH. This test measures the level of TSH in your blood, which is produced by your brain's pituitary gland. TSH tells your thyroid how much hormone to make. If TSH is high, it often indicates your thyroid is underactive, a condition called hypothyroidism. If TSH is low, it might mean your thyroid is overactive, known as hyperthyroidism. A normal TSH usually suggests your thyroid is functioning well. If your TSH results are abnormal, your doctor will often order a free T4 test next. Free T4 measures the active form of thyroxine that is not bound to proteins in your blood. This helps clarify whether your thyroid is producing too much or too little hormone. For example, high free T4 with low TSH can confirm hyperthyroidism, while low free T4 with high TSH suggests hypothyroidism. In some cases, especially if hyperthyroidism is suspected and TSH is low, your doctor might also order a free T3 test. Free T3 measures the active form of triiodothyronine, which can be elevated in certain types of hyperthyroidism, like T3 toxicosis. This test isn't always necessary but can be helpful in complex cases. If autoimmune thyroid disease is suspected, your doctor may recommend testing for thyroid antibodies. These include thyroid peroxidase antibodies and thyroglobulin antibodies. The presence of these antibodies can indicate conditions like Hashimoto's thyroiditis or Graves' disease, which are common causes of thyroid dysfunction. In rare situations, additional tests might be used. For example, thyroglobulin levels can be checked if there is concern about thyroid cancer, and thyroid receptor antibodies can help diagnose Graves' disease. These are usually ordered based on specific clinical circumstances. When you're being tested, most people start with a TSH test because it's the most sensitive indicator of thyroid function. If the TSH is abnormal, your doctor will usually follow up with a free T4 test. Depending on your symptoms and medical history, further testing with free T3 or antibody tests might be recommended. For those already diagnosed with a thyroid disorder and on treatment, regular monitoring of TSH and sometimes free T4 is essential to keep your levels in a healthy range. Testing is especially important during pregnancy, as thyroid function can change and affect both mother and baby. If you're on thyroid medication, your doctor will check your TSH regularly to adjust your dose. If there's concern about the pituitary gland, which controls TSH production, both TSH and free T4 are checked together to get a complete picture. Remember, no single test can tell the whole story. Your healthcare provider will interpret these results along with your symptoms, medical history, and physical exam. Always consult your doctor for personalized advice. Early detection and proper management of thyroid issues can significantly improve your health and well-being. If you're experiencing symptoms like fatigue, weight changes, mood swings, or neck swelling, talk to your healthcare provider about getting tested. They can guide you through the appropriate tests and help you understand what your results mean for your health.